Welcome back. I'm Steve Adubato. More importantly, we welcome for the first time with us. It will not be the last. This is Dan Lombardo, President and CEO, Volunteers of America Delaware Valley. Good to meet you, Dan.
Good to meet you.
Dan, your organization is one of the many not-for-profits out there making a difference in a big way. In this case, you have 3 facilities in Camden. You have other facilities as well, and you're dealing with the homeless population who are affected and challenged in so many ways by COVID-19. Talk about it.
We have been providing services in the Delaware Valley since 1896. Some people I work with think I've been around since then, but don't believe them. We're an organization that works with offenders that are coming back from the criminal justice system to the community. And then we've been operating programs for corrections since 1974. We've been doing services to the homeless for the last 50 years. And what we've done is we do a lot of outreach to the hardcore homeless, folks that are living in the bush, folks that are not wanting to cycle into society. We also do that outreach to vets. We have a program specifically for homeless vets. And so when the COVID crisis hit, what we did is we, of course, went through every change that we possibly could to keep our folks as safe as we possibly could. So we've been sanitizing everything. We've been talking to them about good behavior for cleaning themselves, cleaning their space around them, and so on and so forth. So over the last, 2.5 months, what we've been able to do is really keep the infections down to a very, very low minimum of not more than 6 or so people, which is to us really remarkable. And because of that experience, what we've been asked to do by Camden County is we've been asked to run a hotel for them for the hardcore homeless. And so what we've been doing is we've been doing that now for the last 3 weeks. And what we've been able to do is get folks stabilized into quarantine for 14 days. And then after that, we can move them into supported housing or to some other programs and services. So that with our medical partner and our staff, we're able to not only address the need that they have for medical isolation, but we can also provide social services support.
Those who are homeless are challenged in very unique and profound ways. What does social distancing mean to someone who's homeless?
Well, social distancing is something that they're used to doing. Folks live very independently. Some do not want to be bothered at all. When we do outreach, for example, to folks that have been living in the bush for quite some time, when we outreach to them, it's a matter of building trust and relationship over a period of time. And then what we do is we bring them into a shelter program. Now, a shelter program, the beds aren't quite 6 feet apart, but they're close to that. And they have their own locker and their own space. And for the first time, they have a place that they can really have their own personal belongings. Then we can get them seen medically. We can find out what the issues are that they have been really struggling with, especially if it's addiction or especially if it's a medical condition. And then we can get them seen. And once we have that, we can get folks into services and programs. What COVID-19 has basically done is it allows us to really not only work with them on their personal health needs, but their personal sanitation needs too.
Right.
Themselves as germ-free as possible. And then what we do is we test their temperatures. We take their temperatures a couple of times a day. We might want to make sure that they're eating well. So we provide 3 meals a day. And then we provide 24/7 support.
But Dan, before I let you go, I want to be clear, this is a long-term issue. This is not just in the middle of May. This program will be seen in June, July. This is an ongoing, sustaining issue. And an organization like yours, just like ours, a nonprofit, it has to always raise money. And the folks at Horizon actually told us about your organization. How challenging is it to raise money in these times for a nonprofit like yours?
Oh, it is extremely difficult. And I'm glad you brought up Horizon. They've been a great community partner with us. Matter of fact, if it wasn't for Horizon, we wouldn't have the medical support in our shelter for the people that are homeless. That's been a great gift that they've given to us. And the people that we serve, of course. But for us, we're doing everything that we possibly can to raise money because, as you know, as government money begins to dry up,
that's right,
get tighter and tighter, it's going to be even more difficult to provide services and programs. So then what do? Do you shut them down or do you put folks back on the street? It doesn't make any sense.
Put your website, let everyone know your website, please, Dan.
It's www.voadv.org.
Go on that website. Dan and his team are doing important work for people that too often are forgotten because they do not have a voice sometimes in the halls of power too often. But Dan and his colleagues at Volunteers of America, Delaware Valley, are doing it every day, making a difference for those who are homeless and struggling. Hey, Dan, thank you for joining us. We appreciate it. And we'll also look forward to talking to you down the road. All the best.
Great. Thank you very much, Steve. Appreciate it.
You got it. I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, Hackensack Meridian Health, Seton Hall University, New Jersey Sharing Network, the New Jersey Economic Development Authority, the Healthcare Foundation of New Jersey, the Fidelco Group, Summit City MD, and by Kessler Foundation. Promotional support provided by the New Jersey Business and Industry Association, and by AM 970 The Answer. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.